webcast is the fifth in a series for evidence-informed public health. For this series, we've looked at defining the problem, doing a search for the literature, critically appraising the information, synthesizing it somehow, looking at various criteria to decide if this information will be relevant in your population. And now we're going to talk about adaptation. If the research is good and you think it's relevant to your population, you can begin to think about all of the other factors that come into the decision making for whether or not you're going to use this new intervention or in stopping an intervention. So we have developed a tool that's on our website called the Applicability and Transferability tool. There's a paper on the website to help you understand how we developed the tool through a systematic look at the literature. And then in developing the tool, we have a one-page process about how you might put this tool into practice. For each intervention you're thinking about doing or stopping, there might be different criteria you would want to weight in a different way. So you can choose in this process to weight a particular factor 2 or 3 times any of the other factors, or actually to take out some criteria that might not even be relevant in your situation. Also, in terms of the process, there are some suggestions about getting people to fill it out in advance, either collating their ratings of those criteria, or coming together with their pre-completed ratings and reaching a consensus about each criteria, about how this intervention may or may not work, and the factors that will come into play for making the decision about the intervention. Let me give you some examples of the criteria. The second page is all of the criteria that you might consider in relation to this decision-making process. So there are sections about applicability and transferability, and the applicability ones are making sure you include issues like the political acceptability or leverage that this doing this intervention will bring to your region. So would this intervention be allowed or supported in the current political climate? Will there be a public relations benefit for your local region, your health authority, your health unit if you did this intervention? Would this program enhance the stature of the organization? Would it be seen as a positive thing for your group to do? And will the public and the target groups accept and support the intervention in the current format? There are issues about social acceptability. Is the target population really going to be interested in this? Will you be able to achieve the kind of reach that you would like to achieve with this kind of intervention? Then there's a large section about resources. Do you have the financial resources in your regional health authority to actually put this intervention into place? Not only what will it cost on an annual basis, but what are the kinds of training costs and the support costs that will be coming into play? Are there audiovisual or internet kinds of interventions you will need to do to support what you're wanting to do in this program? Then really, what are you expecting in terms of outcomes and the incremental benefit of having an intervention like this for your community over what they now experience? And finally, in terms of the applicability or feasibility, is there really the organizational expertise within your unit or your regional health authority to do this intervention now, or is it really going to push the organization in terms of the learning, the supports, and the structure within your organization? The second part about transferability is really more about what's the extent of the problem in your area that this intervention will address, and what will the reach be, and really are the target population you're trying to influence, are they really the same kinds of populations that this intervention has been tried on in studies, or have all of the studies that you found really only included university students? So it's really not that transferable to a population like yours. So in considering these multiple questions and having a discussion about that for your own region, you'll make a much better informed decision about whether or not you really want to do this intervention. I'm going to go back to a model that is on a fact sheet on our website, on this wheel that we've produced that you may have, but it considers a number of different areas. One of the big criticisms of evidence-informed decision-making is that it blindly follows what the research evidence says and doesn't consider the population needs, the context, the political situation, or the resources that are required to do that intervention. And contrary to that criticism, from the very beginning, writings about evidence-informed practice, or evidence-based practice, it's been clear that those are critical factors, that for a long time we've not included research evidence in those decisions. And now, even in public health, we have a tremendous amount of research that's applicable to those decisions, and yet for some reason, we've lagged in bringing evidence into this combination of circles, into this Venn diagram. So evidence-informed decision-making is not about just bringing research evidence into the decision-making. It's about bringing research evidence combined with the resources that are available, the context of the regional health authority or the health unit where you work, and what the population preferences and values are. As someone who works in public health, you get to know the community very well, and there might even be some kinds of values, preferences, research that's available for you to consider in bringing into this Venn diagram, all of the issues within this diagram to help you in making the decision. And then it's up to you and your expertise and the expertise of the people and the populations you've brought together when you make this decision about how to use evidence, how to include issues of resources, population preferences, and the community context in making a final decision about whether or not you'll do an intervention. We are just finishing a revision of the applicability and transferability tool that will help you, just slightly reframes the questions for you to consider when you're thinking about stopping an intervention. So you may have done a more recent look at the literature. You might have been doing a program for years, and now you've done a more recent look at the literature, and you found that, in fact, there's not good evidence for a program you have been doing. You used to think the evidence was good enough, and now there's more evidence to say really isn't a good effect of this intervention, and you're thinking about stopping the intervention. So each of the criteria is reworded slightly. If you're thinking about stopping an intervention, will there be a political backlash? Will the population be unhappy that this intervention has stopped? Are you losing some other important contact with the community that this intervention might be allowing you to have? So there's the original tool of assessment and applicability and transferability for those programs you're thinking about beginning, and a revision of those questions to consider when you're thinking about stopping an intervention for your community. So both of those are available on our website, again, www.nccmt.ca, and I hope you explore those, try them out, and look for some other useful tools.